patience while we get ourselves set up here this morning. My name is Debbie Hayes, and I'm the Upstate New York Area Director for the Communication Workers of America, and we're here to talk to you this morning about our ongoing negotiations with Kaleida Health and our scheduled strike vote. Just to give you a little background information, our current collective bargaining agreement expired on May 31st, 2025. We've extended it twice now so that the current extension expires tomorrow at midnight. The agreement covers approximately 8,000 workers that work at the Buffalo General Medical Center, Oshai Children's Hospital, High Point, DeGraff Medical Park, Millard Fillmore Suburban Hospital, and a variety of clinics, blood stations, draw sites, etc. So we really have a health system that is spread across the Western New York community. The members we represent really run the full gamut of healthcare workers. So we represent NPs, PAs, registered nurses, pharmacists, LPNs, folks in all of the professional laboratory sciences, the whole scope of professional job titles, including our folks that keep the hospital clean for us, serve the food, work in our various business offices. So just so you also know, we have a mediator that we retain to work with us, who has been familiar with our set of negotiations and has been with us for quite a while. So the first speaker that I want to introduce to you this morning is Corey Gambini. Corey's the president of CWA Local 1168.
Yeah, you know,
I can do whatever. Oh, thank you.
good. Welcome everybody to our humble home for the last 4 months. CWA District 1, CWA Local 1168 and 1199 SEIU are announcing a strike authorization vote at Kaleida Health. It will be held July 9th, 8th and 9th from 6 a.m. to 9 p.m. at the Wyndham Garden Ellicott Room, 125 High Street in Buffalo, right across from the Buffalo General Medical Campus, the GVI and Oshai. July 10th only will be at 6 a.m. to 9 p.m. at CWA Local 1168, which is at 1900 Sweet Home Road at Amherst, in Amherst near 14228. A yes vote to authorize a strike is to give the bargaining committee the power at the bargaining table to call a strike when needed. It does not mean that once we do a strike vote and that we're going to be putting Kaleida Health healthcare workers out on strike. So I just wanted to be clear about that. Since March 4th, we have been engaged in negotiations with Kaleida Health. We've made progress in many areas, but our key concerns are still unresolved. And we have yet to see the essential actions from Kaleida at the bargaining table that are crucial for our members. We take great pride in the groundbreaking agreement we achieved in 2022, marking the first time we successfully negotiated staffing ratios within our collective bargaining agreement, as well as the New York State staffing law that took effect in January of 2023. We were hopeful and excited that we could improve the working conditions of our members and provide improved quality care to the community when they seek medical care at Kaleida Health. Although we have made progress, we still have a way to go. Staff members frequently work with an inadequate number of staff. Like many hospitals across New York State, including our local facilities, we have submitted thousands of complaints and prompted visits from the Department of Health. Kaleida then had to submit a plan of correction to the state, yet we continue to operate short-staffed in many areas, and we continue to file the complaints. We must enforce the staffing provisions in our contract, and New York State must also uphold the law. Our 2022 agreement is not a one-time achievement. It serves as a foundation that we must build upon. For the sake of our patients and our members, we must continue to advocate for enforcement and improvements. The best chance we have to accomplish this is during contract negotiations. Thank you.
Our next speaker is gonna be Mary Kolersky, who is an RN and is a clinical nurse educator at the Buffalo General Medical Center. Do you wanna move these?
Yeah.
Do I have to spell that?
Yes, please.
Oh, thank you. It's her speaking?
Yes.
Okay. We can
It's
just
me.
move it over here. Oh.
Okay. There you go. That's right. Equipment, right? Good morning. My name is Mary Kolersky, Kolerski. I'm a registered nurse at Buffalo General Hospital. I'm a 35-year employee who currently serves as a nurse educator for the hospital system. I have the privilege of working with the new nurses as they come in to our facility. And I also work with the experienced nurses who work along with them in my daily work. The new nurses are bright, dedicated professionals who want to make a difference in taking care of patients. They are starting their careers at Kaleida with us. The experienced nurses want to develop and support those new nurses in their new professional role. But too often we find the collaboration of the new and experienced nurse starts in an overwhelming, understaffed nursing unit. And with that comes chaos. I see the toll the chaotic environment has on the relationship between the new nurse, the experienced staff, and on the care that patients receive. We are losing great nurses because the current system isn't adequate to support their progress. This contract fight is about fixing that. It's about creating a work environment that supports training, that supports the nurse, and that retains the caregivers that we so desperately need in our community to take care of patients. I'm voting yes to authorize a strike if needed, because the future of nursing depends on what we do right now, and I believe we can do better together. Thank you so much.
Very nice, Mary. All right, our next speaker, we probably could have arranged this better. Our next speaker is Betty.
So make sure everyone's awake.
Our next speaker is Betty Thomas, who is a Thompson, I'm sorry, Betty, who is a patient care assistant at Millard Fillmore Suburban Hospital. And she's gonna talk to us a little bit about the wage and benefit situation. So it has to go down, folks.
I wanted to shake up our colors.
Thank you.
Thank you.
That's straight, come to me.
Hi, my name is Betty Thompson, the
TTYTHOMPSON, and I'm patient care assistant at Miller from Suburban, where I've worked for 25 years, and I love my job. I work directly with patients, helping take care of them, helping them with their daily activities, getting them out of bed, and helping them heal. As the committee, as the committee members, we unanimously voted on calling a strike vote because as a service worker at the bedside, we help keep our facilities clean and help feed the patients and help sanitize areas. And we deserve competitive wages and equality of benefits to help take care of our families.
Thanks, Betty. Okay, and our last speaker is gonna be Cheryl Marino, who is an 1199 SEIU organizer. And Cheryl's right here. Do you wanna kiss her?
That's why I was already giggling.
They don't have to move everybody. Or maybe back to the middle, I don't know.
She's next.
No, she
Her,
is.
and then you're finishing?
Well, just be ready for questions then, yeah.
Let's not.
Yeah, yeah,
I get
yeah.
it.
Did we stress you out today?
Yeah.
Yes,
I'm sorry.
It's too early for this stress.
it's my end of my show.
Oh,
I'm really sorry about that.
No, you're good.
Good morning. My name is Cheryl Marino, CHERYLMARINO. I am administrative organizer with 1199 and one of the lead negotiators at the bargaining table. I'm here to talk about, we are well aware during these negotiations that we have these looming Medicaid cuts in the background. We have many millions of Americans who are set to lose their health care coverage. 1.5 million of those individuals are New Yorkers. 40% of those are children. And so when I hear waste, fraud, and abuse and that they wanted to get rid of it, the reality is, how can taking away $65 million from safety net hospitals be waste, fraud, and abuse? We are in tough times right now, and we have two congressional representatives, Claudia Tenney and Nick Langsworthy, that are voting for these cuts. These will devastate hospitals, including rural hospitals. So the Brooks Memorials, the Bertram Chafees, even Niagara Falls Memorial, have the ability to lose their services and to not have the new hospital built at Brooks. So we are aware of it. It's an unfortunate set of circumstances, and we are here negotiating during these tough times to make sure that our patients in our community are well taken care of. But people need to get out there and make their voices heard, that these Medicaid cuts cannot go through. Thanks.